Welcome to Fund to Money, your 24 into 7 buddy for all your money matters. Tax saving investment season is all about to come to an end, all set to come to an end, and you're looking around for what are the various tax deductions you can get. You have already exhausted Section 80C tax deduction of 1.5 lakhs, or maybe you've gone in for National Pension Scheme. Now you're looking at what are the other sections, and then you're informed that you can, if you buy health insurance plans which qualify for Section 80D deduction, you can actually save more tax. But the most common mistakes that a lot of people do is they focus on buying health insurance to the focus is primarily on saving tax. Why that is not a great idea, why you need to look at other things apart from tax savings is something that you need to know. And the good news is, with us is eminent insurance expert Swami Sharma with us, who in a very little while will tell us what are the other things that you need to keep in mind while buying health insurance plans which give you Section 80D benefits, but you need to wait just a little longer. Welcome to Fund to Money, Swami. Swami, we all know that there are various tax deductions available to people who buy health insurance plans. But of course, you will be the first person to tell anybody that you need to buy health insurance regardless of whether you get tax benefits, number
Right.
one. And number two, even at this 11th hour, if somebody is actually buying this plan, what are the three or four very essential things that they must keep in mind?
Okay. As you have rightly said, I think health plans should be totally independent of tax saving because it is your basic requirement. So while purchasing the policies, while looking at them, one should definitely look at a couple of things which are like how the policy is dealing with your pre-existing diseases. Many of the policies they will cover your pre-existing diseases after a span of time. Some will cover after 2 years, some after 3, or some after 4 years. So one should go for the policies which stipulate the minimum amount of restriction. And secondly, which practically which becomes a problem later is the capping on the room rent
Okay.
in the hospitalization. Once you invoke the policy, you are in the hospital. If God forbid one have to avail for it, then none of the hospitals actually are cheap these days. So then it starts pinching you. Say if you talk about NCR in say in Gurgaon, uh, the minimum room rent for the hospitalization in a decent hospital will not be less than say 7 to 8,000 rupees a day. So if there is a capping in the policy, you virtually get nothing.
Okay.
So if you go for a 5 lakh rupees policy and the capping is 1% of the sum insured, you will not be paid more than 5,000 rupees a day. So whatever is the extra cost, one has to pick up. And there are some policies these days, one can look at those policies also, which restore the sum insured even after making a claim.
Right.
So those are very important. And what kind of incentives they give you for not claiming. So there are policies
Okay.
which will give you even 100% sum insured as incentive for not claiming. So these are the few things which one must consider while buying the policy.
I'm sure the viewers would have found it useful. Let me try to add two general bits. Like all insurance plans, one of the things that you need to keep in mind is insurance plans are supposed to give you benefits, and you're paying the premium to get benefits. So you need to know what are those benefits. If you don't know what those benefits are, then you practically don't know what you're paying for. And I'm sure you would agree that you need to know what you're getting for your money. That's number one. Therefore, it's also equally important to know what is not getting covered. So those are exclusions. So you need to know what you're going to get covered for, what you're not going to get covered. That way you'll not have a fight with the insurance company, and you get to save your tax and you get a good coverage. Even at this 11th hour, if you're buying a plan, a health insurance plan, whether it's for you, whether it's for your parents, there are different tax deductions you get. There's already a video in our channel which will tell you. You can ask your financial advisor or the agent who's helping you out. But these are very important. As Swami mentioned, pre-existing diseases is important. What is getting covered, what is not getting covered, caps, restrictions. These are the things. What basically are you going to get for the money that you pay? That's the bottom line. So you need to ask that question. If you can't get that answer by yourself, ask it from someone who knows. Don't get into a plan which you don't understand, where you don't know what it is all about, just to save tax, because later you will not be satisfied with what you've got. So the important thing is for you to get value for money. I'm sure whatever Swami has mentioned to you is useful. Did we miss out something very important? Why don't you share it with us in the comment section? If you like this video, what are you waiting for? Go and click on the like button. Use the closed caption feature for this video. We are doing this through the Google Hangouts. There are always internet sort of slippages, so that'll help you stay connected. Check out the description section. There will be useful links and also the highlights of this discussion. Stay connected with us on all leading social media platforms. Last but not the least, visit our website www.fundomoney.com.